Welcome to Nutritional Medicines by Lab Analysis. I'm Dr. Cyrus Thomas. I've been a chiropractic physician, practicing nutrition for some 34 years, and I also have a medical doctorate in homeopathy from India. What we're talking about on this program is using nutrition as medicine, using nutraceuticals as prescribed substances versus pharmaceuticals as prescribed substances. And then using the best that modern medicine has to offer in blood analysis, urine analysis, hair analysis, saliva analysis, stool analysis to determine which nutraceuticals to use to treat a person, mostly for chronic ailments and for longevity and attaining a long life with good quality. This week's program is What's New in Medicine. We're going to be getting a lot of information from Integrative Medicine, which is a clinical journal. First off, let's talk about some dietary myths about niacin. Maintaining high-density lipoproteins, HDL, called the good cholesterol, within the normal range is an important factor in maintaining heart health. HDL cholesterol is also known as good cholesterol because it is thought to help move cholesterol out of the arteries and into the liver so the body can get rid of it. But it's also a good cholesterol because HDL goes up when we are physically active. Now, the body doesn't say, oh good, he or she is exercising, let's increase the HDL and give them a reward. Rather, it was more evolutionary. In the paleo days, when man would go hunting and he was very active, he was much more likely to get injured by scratching himself on trees and bushes, hurting his feet, running through the jungle. And so when one was active, more natural antibiotics, antimicrobials were needed in the blood to deal with all those cuts and scratches. HDL, it turns out, much like LDL, when it's elevated, work as natural antibiotics in the body. So that's another reason why HDL goes up. Nicotinic acid is a type of B vitamin that occurs naturally and is clinically proven to support HDL. But due to the nature of its name, consumers in need of heart health support may incorrectly associate nicotinic acid with nicotine, the addictive ingredient in cigarettes. What health-minded consumers need to know is that nicotinic acid is not nicotine, and in fact is the only form of dietary supplement, niacin, clinically proven to support healthy, good cholesterol. There's another thing you need to watch out for. Let's look at this bottom paragraph. Dietary supplement niacins advertised to be flesh-free contain inositol hexaniacinate. Inositol hexaniacinate, or nicotinamide, but often called nicotinamide, but does not contain the key ingredient, nicotinic acid. Dietary supplement niacins come in many forms, but only supplements containing nicotinic acid are clinically proven to support good supplement niacin that gradually delivers nicotinic acid to the body, like the unique polygel controlled release system utilized by Slow Niacin, which is designed to minimize the symptoms of flushing. People can take nicotinic acid and all of a sudden they turn red and they feel hot and prickly all over, and so they know niacin is a very uncomfortable thing. But this slow release nicotinic acid is another thing. Promising results for tests that better evaluate potential heart attacks. Okay, blood tests for troponin. It's a protein found in the heart muscle, and it can detect heart muscle injury. So this is a new test that we're going to be seen being done much more often in emergency rooms. Acute chest pain is one of the most common reasons people seek emergency care, and time is a critical factor in diagnosing and treating people who may be having a heart attack. So if a person thinks they have a heart attack, we now have a new test that we can do to see if in fact they did. A question for you to answer. Why do most Americans believe that America has the most advanced medicine in the world, yet the World Health Organization says we are 38th in world health? Everybody thinks that Most people in the world come to the United States for medical care because we have the best medical care on the planet. That really isn't true. Most people with a lot of money go to Europe, Germany, France, and they seek many new methods that are being used there that aren't being used in the United States because the FDA is a very slow process of okaying the sale of new drugs in this country. But 38th, that's a pretty low number. It comes from not only how available our health care is to people who need it, but also it involves the cost of that care. Here we are with all of the different countries. The dark blue is the total public coverage of health care, and the lighter blue is the primary private health coverage. You'll see the United States here in the fourth one down has a short line of dark blue and a very long line of primary private health coverage. Total public coverage is quite low for us. In fact, the public coverage is the lowest of all of these countries. And even the total amount of health care given is reduced, along as also with Turkey, Mexico, and Chile. So not good statistics for us. These are the 36 countries that have better healthcare systems than the U.S. The U.S. healthcare system came in 15th in overall performance and first in overall expenditure per capita. We were first in overall expenditure per person. That result meant that its overall ranking was 37th. In France, expenditure per capita rank, they were 4th. The French system combines private and public sectors to provide universal health coverage to all. Most citizens receive their insurance through their employer, and almost everyone has supplemental private insurance. The majority of medical bills are paid for by the government, funds from payroll and income taxes, and the remainder is footed by individuals' supplemental private insurance. And yet somehow we love capitalism. Computerized lab analysis using blood, urine, and hair analysis to diagnose for chronic illness. This is a report that we have done after we collect the data from the hair. This is all the data from the patient. These are all the patient's complaints. Then we collect the blood and the hair data. We put it all into a computer program in Dayton, Ohio, and regenerate this 15-page report. We interpret all of the results. We look at all the meds that a person is on, all the contraindications. We look at coronary risk, cardio risk, possible cardio risk, diabetes, anemia, possible infection. This explains how to read blood values, explains how to read hair values. This person had high arsenic and high chromium and high lead in their hair, a good indication that there are a lot of heavy metals and free radicals in the blood. It also gives dietary recommendations. It gives extra recommendations for physical exercise, things to know about water and clean air. If you're diabetic, we go into extra depth in the recommendations. We use this blood test that is 52 elements long, and this person had a number of retests over a 2-year period so that we could compare by color coding how they were making progress. This is their hair analysis, their first one, and then their repeat study, so we could then see the colors changing back to where they should be. It also gives a supplemental recommendation to the person. This supplemental recommendation we alter to some degree because we know you differently than the computer knows you. So we don't just use a computerized analysis, although it is an extremely handy tool. This is a close-up looking at diagnostic findings for coronary risk assessment. This tells how we look at the different cholesterols that are in the body and we come up with a coronary risk assessment for this person. This is how we explain it in paragraph form. But what's unique about this study is that it says these are the elements in the blood test that point to possible cardio effect. The creatinine kinase is a little high. It could also be a sign of a more serious condition developing. The C-reactive protein is high, which indicates nonspecific tissue injury and inflammation. It also says that this finding is supported by high blood creatinine, high blood SGPT, which is also called ALT, it's a liver enzyme, high blood CRP, or C-reactive protein, and low blood hematocrit, or the amount of blood that is actually made up of red blood cells. Those factors combine together with the medications this person is on, Lipitor, Prilosec, naproxen, and Zetia, all lead to possible cardiac effects. The nutrient recommendation was an inflavonoid, turmeric, for this person to help correct these anomalies. We also suspected inflammation of the liver. Again, this is a close-up of the report we looked at previously. So we're not only correlating blood findings such as high blood globulin, high blood erythrocyte sedimentation rate, but we're also looking at the medications they took, diflucan, Lipitor, Prilosec, naproxen, and that helps us all come up with a diagnosis of silymarin, or milk thistle, and vitamin C for this individual. This is in my office. Of course, we take blood pressure. We look in the eyes to look in the back of the eye to see the condition of the arteries in the back of the eye. That's actually why a doctor looks in your eye. An optometrist has a different reason, but a general practitioner looks in the eye to look at the blood vessels in the back of your eye. Blood pressure, of course, is important. We also palpating the surface of the body for any tumor formation that might be there. We look at the condition of the fingernails to see about mineral content. We look in the ears. So this is just essentially a physical examination on this individual. But we're also, you can see in the background, we've got x-rays. So we look at x-rays on the person. I've done some 16,000 x-rays in my day. I'm less likely to do x-rays now because of a lot of study that has been done on the damage of x-ray. X-ray is now considered to be the leading environmental cause of breast cancer. Also, children who received the chest x-ray were 4 times more likely to develop asthma than children who had not received an x-ray. That's an alarming statistic. A lot of work has been done on this now, and so it is coming to the forefront, and in the next 10 years, I believe hardly anyone will get a CAT scan. Now let's see if we can progress here. This is a diagram of what the average American is eating. Here we know that in the last 30 years we have shown an explosion in nutritional knowledge. Nutraceuticals are medicines, and they are complex molecules. Don't stop your medicines, however, unless you make changes. You need to make changes in your life to be healthy and to be able to not be dependent on pharmaceutical medications. Of interest, there's an interesting statement. It says, genes load the gun and the environment pulls the trigger. So you're born with a certain propensity to have certain problems. But unless the environment is such, and the environment also includes the tons of food that run through your body on a yearly basis, that also is, food is part of environment. It's your environment that pulls the trigger on the genetic susceptibility that we have. So we can't just say, oh, my father had it, my grandfather had it. That's not good enough. If we change our environment, we can reverse the propensity to get certain chronic ailments that our ancestors got. High fructose from fruit or high fructose corn syrup can cause a high blood uric acid, known to be gout. And of course, we've always blamed red meat for gout, haven't we? That's been a mistake. It's mostly high fructose corn syrup, and this makes liver enzymes go up. Milk thistle is not indicated for people who have high liver enzymes due to high fructose corn syrup. Also of interest, since fat cells store toxins, it makes sense to detoxify before losing weight. Otherwise, the loss of weight will release toxins into the blood, and the patient will not feel good, and they will get discouraged. So because your fat is holding on to toxins, get rid of the toxins first. Otherwise, if you start losing weight, those fat cells will dump those toxins into the blood. You'll feel lousy and get discouraged. When fibrosis of the liver affects blood flow, then you have what's called cirrhosis. Now, for fibrosis of the liver is when the liver is becoming fibrous. It's becoming harder and tougher and more callous and scar-like. When that happens and it affects the flow of the blood, we can then say you have cirrhosis. When cirrhosis affects other organs, then you have ascites. And ascites is when there's a lot of swelling. The abdomen can become huge, and that's an emergency room treatment. ALS, or amyotrophic lateral sclerosis, is a clinical data chosen, ALS clinical data chosen to kick off the first Israel Neurological Association meeting. The trial, bone marrow derived autologous differentiated mesenchymal stromal cells. I didn't want to make this too complicated. All of whom suffer from early stages of progressive ALS, also known as Lou Gehrig's disease. All patients enrolled were transplanted with NurOwn, either intramuscularly or intrathecally. So they're doing some essentially stem cell work now on patients with Lou Gehrig's. Lou Gehrig's is essentially when the very upper part of the spinal cord begins to die, and the nerves become demyelinated, and you end up with twitching, and then after 2 or 3 days of twitching, the muscle actually atrophies. So your body slowly atrophies and you become paralyzed. It takes about 1 year or 2 to die. It affects about over 5,000 men a year in the United States, and I think 2,000 or 3,000 women. Very nasty disease. Here's a case of a 52-year-old woman who had high cholesterol of 621. She had a high triglyceride of 766. She had irritable bowel syndrome, tension headaches. She gained 50 pounds in the last 3 years. She had 4 biopsies on both breasts, which were benign. She had sinus and ear infections, and she gets hives frequently. She went on nutrition. She did our program. She did the hair and blood analysis. We sent it through the computer in Dayton, Ohio. We put her on nutrients, and within 2 months on the program, her cholesterol had improved from 621 down to 190. That should be 198 in just 2 months. Triglycerides went from 766 down to 199. She feels much better. Everything is greatly improved. The thyroid is back to functioning normally. Her weight loss is 20 pounds. She's off all her prescription drugs, and her hot flashes are much improved. That's good news. Instead of saying my body isn't working right, I need to add some drugs to make it work right. Besides, the doctor will know what to do. Say instead, my body isn't working right, and instead of taking a drug that will have 30 side effects, I need to return my body to the state it was in before my symptoms began, but supporting it with natural products. Get the body healthy, and it will cleanse itself well. The blood test that we do, we color it from yellow to red to blue. Yellow is a warning. If it remains white, it gets a green star. If it starts to move outside of a normal range, we give it a red, and if it moves far out of a normal range, it gets a blue. So on this person's first test, they had a lot of red and several blues. On their subsequent test, the blues were gone, most of the reds were gone, and they had turned into yellows, and they were doing quite well. This is a nice way to rate a person's progress: warning, high risk, and critical. One of the problems is that the healthy range for tests Where we used to say you need to be within this range to be considered healthy, all the laboratories around the country, on the advice of American Heart Association, American Diabetes Association, and organizations of this sort, have been increasing these ranges. So people who are really quite sick don't look so sick anymore, and we don't have to report them as a national failure in how well we're doing with health care. For example, hemoglobin A1C is a very, it tells you how your blood sugar has been doing over the last 3 months. It's the best indicator of diabetes that we have. The range used to be 3.4 to 6.1, and now it's been increased to go up to 8.0. So before, if you passed 6.1, you were in trouble. Now you're allowed to go to 8 before we consider it to be a problem. So we can reduce the number of people who we say have diabetes, and we can also look like we're fighting the war on diabetes better. In fact, we're not. There's a new word called diobesity, which essentially means that the same standard American diet called SAD, which brings you into diabetes, is the same diet which brings you into obesity. So they are one and the same, diobesity. We like to use a much more narrow range. Laboratories like to use larger ranges. We think that's a disservice to you, and we bring it in and make it tighter. Advantages to computerized lab evaluation. In doing this, many more tests are ordered than by regular doctors, including we order cancer markers as well. Most docs don't like to order cancer markers because it scares the patient, but we educate the patient and say, we need to know about this so we can know how well you're dealing with the cancer cells that your body is producing every day, how many of them you're producing, and also to know how well your immune system is phagocytizing them or gobbling them up, which needs to happen on a regular basis. The ranges we use are more stringent, I've showed you that. The lab results are compared with those of other patients and also with the results that the nutrients prescribed for them were able to obtain. In other words, we're running your blood through a comparative study with patients who are taking nutrition to get well. We're not comparing you with people who are taking 6 to 12 different pharmaceutical medications, who are drinking alcohol, maybe smoking cigarettes, doing Coca-Cola and 7-Up all day long, and just eating a lot of processed foods. Why would we want to compare you to those people? If you're somebody who wants to do nutrition to get well, you're probably living a much better lifestyle, and we should compare your results to people like you. That is not being done anywhere but here. Follow-up studies are compared side by side with all the results clearly seen and marked. In other words, the color coding that we use. So when you get a follow-up study, we see how well you've done. We see in what areas you may not have done so well and in which we still need to make improvements. People need to know that you're always changing molecules from one molecule into another, molecule A to molecule B. To do so, you need enzymes. Molecules come together, the enzymes change that molecule, and off they go. They're different. Now, what works as enzymes in the body like this? Well, vitamins can be an enzyme, so can minerals, so can amino acids. You've got to have them in your body to function properly. They just have to be there. When we look at all the different types of medicine that are available, we've got structural medicines like chiropractic and massage. Molecular includes food, nutraceuticals, herbology, and pharmaceutical drugs. There's lots of different talk therapies as well. When we look at just the food, nutraceuticals, herbs, and controlled drugs, that these are all chemicals. They all go into the mouth, into the intestines, and then to the blood, and then to the cells. They all go into the cells and affect the chemistry there. The difference is that nutraceuticals are naturally occurring, such as in foods and nutraceuticals and herbs. They are non-patentable and at low cost. Controlled drugs, however, are patentable and at high cost. Pharmaceutical man-made drugs usually are able to perform what we want them to perform. Trouble is, they also perform 30 other functions that we don't want them to. Those we call side effects. When you're taking naturally occurring substances, they usually perform 30 things that we want them to do, and rarely, if ever, have any side effect whatsoever. Like there's no side effect to eating broccoli. And if we extract something that's in broccoli that is very good for us and we concentrate it, that won't have any side effect either. Naturally occurring substances makes up for what is missing in our food. It supplies what the body would normally require, and it makes the body work the way it did before it became ill. An important point. Code of Honor by Dr. Van Merkel. He says he does his very best and he will not be distracted and he'll only order what the patient needs. This is my office. My website is www.integrativealternativemedicines.info. So if you write that down, you'll be able to see all the other TV shows we've done here on thyroid and adrenal and pancreas and all kinds of body ailments, Alzheimer's, fibromyalgia, etc. I'd like to thank the Community Media Center of Marin for making the studio available, Vida Flores for being our director today. My phone number is 847-5020. Again, go to the website, though. There's lots of information there. You can read about your ailment in particular. You can read about the ailment of other people as well that you might care about. Integrativealternativemedicines.info. I'd like to thank you for watching our program because I've been doing these for about a year and a half now. Try to bring different topics to you all the time. Today's was What's New. I'm also going to be covering in the next show the cost of laboratory analysis. When you go for a blood test, it isn't, I got blood tests. You actually have a choice of 1,000 different tests to be done. That negotiation needs to take place with your practitioner, your doctor, and you negotiate what it is that we should be looking for in you, what your weak areas might be. We then perform all of those blood tests and go from there. Thanks for watching, and may you be in good health.